Can you take NSAIDs while taking beta blockers? Have you ever wondered if it is safe to take nonsteroidal anti-inflammatory drugs while on beta blockers for hypertension? This is a common concern for many individuals managing high blood pressure. Let's break it down to understand the interaction between these medications. Beta blockers are often prescribed to help lower blood pressure by slowing the heart rate and relaxing blood vessels. On the other hand, nonsteroidal anti-inflammatory drugs are typically used to relieving pain and inflammation. However, these two types of medications can affect each other in ways that may complicate blood pressure control. When nonsteroidal anti-inflammatory drugs are taken, they can lead to an increase in blood pressure. This happens because they promote sodium retention and reduce the production of prostaglandins. Prostaglandins are important for keeping blood vessels open and maintaining kidney function. When their production is reduced, it can lead to higher blood pressure, which is the opposite of what beta blockers aim to achieve. Specifically, nonsteroidal anti-inflammatory drugs inhibit cyclooxygenases enzymes, which are responsible for prostaglandin synthesis. This inhibition can cause sodium and water retention, increasing blood volume and blood pressure. Since beta blockers work partly by inhibiting renin secretion, which is involved in blood pressure regulation, the effectiveness of beta blockers can be diminished when nonsteroidal anti-inflammatory drugs are used. Clinical observations suggest that non-selective nonsteroidal anti-inflammatory drugs are more likely to raise blood pressure in patients who are already taking beta blockers. The extent of this interaction can vary based on the specific nonsteroidal anti-inflammatory drug, the type of beta blocker, and individual patient factors. For those prescribed beta blockers, healthcare providers usually recommend caution when considering nonsteroidal anti-inflammatory drugs. Alternatives like acetaminophen may be better options for pain relief, as they generally have less impact on blood pressure. If nonsteroidal anti-inflammatory drugs are necessary, it is important to monitor blood pressure closely and possibly adjust antihypertensive therapy. Moreover, combining nonsteroidal anti-inflammatory drugs with other antihypertensive medications, such as angiotensin-converting enzyme inhibitors or diuretics, can increase the risk of kidney damage. This concern highlights the need for careful medication management in patients with hypertension. In summary, while it is not strictly prohibited to take nonsteroidal anti-inflammatory drugs with beta blockers, it is essential to do so under medical supervision. This helps to ensure that blood pressure control is maintained and to prevent any potential kidney issues. Always consult with your healthcare provider before making any changes to your medication regimen.